Most people believe dementia begins with memory loss. Forgetting names, repeating questions, losing track of conversations. But subcortical vascular dementia does not start that way. In fact, by the time memory problems become obvious, significant and permanent brain damage has often already occurred. Subcortical vascular dementia is a specific and highly common form of vascular dementia that affects the deep structures of the brain, the areas responsible for processing speed, movement, emotional regulation, and executive control. According to research published in leading neurology journals, subcortical vascular dementia accounts for approximately 40 to 50% of all vascular dementia cases. Yet despite its prevalence, it remains one of the most underdiagnosed causes of cognitive decline in adults over 65. What makes this condition especially dangerous is how quietly it develops. Unlike Alzheimer's disease, it does not begin with obvious memory loss. Instead, it starts with changes that seem unrelated to dementia. Slower thinking, subtle walking changes, emotional flatness, difficulty planning or organizing tasks, even urinary problems. Most people, and sometimes even doctors, attribute these signs to aging, arthritis, stress, or unrelated medical issues. But biologically, something very specific is happening. Subcortical vascular dementia is caused by small vessel disease, damage to the tiniest blood vessels in the brain. These vessels, thinner than a human hair, supply oxygen and nutrients to the deep white matter and subcortical structures that allow different brain regions to communicate efficiently. When these vessels become diseased, the brain tissue they supply does not die suddenly. Instead, communication between brain regions becomes slow, inefficient, and disrupted. This is why early symptoms involve slowing, not forgetting. Medical studies show that these early changes can appear months or even years before obvious cognitive impairment, creating a critical window where intervention can slow or even halt progression. That window is often missed, because the warning signs don't look like dementia. Someone walks more slowly, takes longer to respond, seems emotionally distant, struggles with tasks they once managed easily. These are the moments when action matters most. In this video, you'll learn 8 key warning signs of subcortical vascular dementia that everyone over 65 and their families need to recognize. One of these signs is so commonly misunderstood that diagnosis is often delayed for years, allowing preventable brain damage to continue unchecked. Before we continue, one important clarification. This video is for educational awareness only. Only a qualified medical professional can diagnose subcortical vascular dementia through proper cognitive testing and brain imaging. However, recognizing these signs early can prompt timely evaluation, and that can change outcomes. Now let's begin with the earliest and most overlooked warning signs. The ones that appear long before memory loss, and long before it's too late. If there is one reason subcortical vascular dementia is so often missed, it's this. It doesn't look like dementia at first. There is no dramatic memory loss, no sudden confusion, no obvious personality collapse. Instead, the disease begins by slowing the brain's internal communication systems, the deep white matter networks that allow different brain regions to work together efficiently. Because of this, the earliest symptoms affect speed, coordination, planning, and control, not memory. Sign number 8. Progressive slowing of thinking and processing speed. This is usually the first measurable change. The person does not forget information. They simply process it more slowly. You may notice longer pauses before answering questions. Simple decisions, what to eat, where to go, take noticeably more time. Conversations that move quickly become difficult to follow. Multitasking becomes nearly impossible. This is not normal aging. Research shows that processing speed decline often appears 1 to 2 years before other cognitive symptoms in subcortical vascular dementia. The reason is biological. Processing speed depends on intact white matter pathways, the brain's communication highways. Small vessel disease damages these pathways, forcing signals to travel through inefficient routes. Nothing is forgotten. Everything just moves in slow motion. This slowing affects every cognitive function, because processing speed underlies memory, attention, language, and problem-solving. Sign number 7. Executive function problems, planning and organization. As communication slows, executive function begins to fail. Executive function allows us to plan, organize, sequence, and complete multi-step tasks. When it breaks down, daily life becomes surprisingly difficult. A person who once managed finances struggles to organize bills. A capable cook can't coordinate multiple dishes. Planning even simple activities becomes overwhelming. Importantly, they often know what needs to be done, but cannot organize the steps to do it. This pattern is highly characteristic of subcortical vascular dementia. Studies show that executive dysfunction appears in up to 80% of cases, often before clear memory impairment. The frontal lobes generate plans. Subcortical structures help execute them. When the connections between these regions are damaged, planning remains intact, but execution fails. This loss of executive control directly threatens independence, safety, and medication management. Sign number 6. Slowed movement and changes in walking. One of the most overlooked early signs is change in gait. This is not arthritis. It is not simple weakness. It is a neurological walking pattern. Steps become shorter. Walking becomes slower and shuffling. Feet lift less from the ground. Turning requires multiple small steps instead of smooth movement. Balance becomes unstable, especially when changing direction. Doctors often describe this as a magnetic gait, where the feet appear stuck to the floor. Research shows these gait changes can appear months or even years before cognitive diagnosis and are particularly common in subcortical vascular dementia. The reason is structural. Subcortical brain regions, especially the basal ganglia, coordinate smooth movement. Small vessel damage disrupts these circuits, making movement slow, rigid, and poorly coordinated. These walking changes dramatically increase fall risk and often represent one of the earliest physical warnings of subcortical brain damage. Why these signs matter? At this stage, memory may still seem intact. The person may pass basic screening tests. Family members may feel reassured. But biologically, the disease process is already active. The damage is progressing quietly. And without intervention, it continues. By the time we reach these signs, something critical is happening. The brain damage is no longer subtle, but it is still potentially preventable from getting worse. These symptoms are the ones families most often misunderstand, misattribute, or completely disconnect from brain disease. That delay is costly. Sign number 5, urinary urgency or incontinence without a clear cause. This is often the most shocking sign. People assume bladder problems have nothing to do with the brain. They blame aging, prostate issues, weak bladder muscles. But in subcortical vascular dementia, urinary problems are often neurological. Bladder control depends on circuits connecting the frontal lobes to subcortical structures and the spinal cord. The frontal brain normally suppresses the urge to urinate until it's appropriate. When small vessel disease damages these circuits, that control weakens. The result: sudden urgency, little warning, inability to hold urine, episodes of incontinence, even though urine tests are normal and no infection is found. Studies show up to 50% of patients develop urinary symptoms early, sometimes before obvious cognitive changes. This is not a bladder problem. It is a brain signal control problem. Sign number 4, emotional and personality changes, especially apathy. Families often describe this as, they just don't seem like themselves anymore. The most common change is apathy. Not sadness. Not grief. Not emotional distress. Just indifference. The person loses interest in hobbies. Shows little emotional reaction. Lacks motivation. Needs prompting for basic activities. Appears emotionally flat or disengaged. This is not depression. In depression, people feel distressed about their lack of interest. In apathy, people simply don't care. Research shows 60 to 70% of people with subcortical vascular dementia develop apathy, often early in the disease. This happens because subcortical structures help regulate motivation and emotional drive. When their connections are damaged, emotional output becomes blunted. Irritability, emotional instability, or socially inappropriate behavior may also appear. These changes often confuse families and delay neurological evaluation. Sign number 3, attention and concentration problems. Attention begins to fracture. The person can't focus on conversations, becomes easily distracted, loses track of what they're doing, struggles to follow stories or instructions, cannot handle more than one task at a time. This is not forgetfulness. It's a failure of the brain's filtering system. Subcortical structures, especially the thalamus, normally filter incoming information. When damaged, too much information floods consciousness at once. The brain becomes overwhelmed. Memory tests may appear poor, not because memory is damaged, but because attention is too weak to encode information properly. Sign number 2, slowed or slurred speech. Language itself remains intact. Vocabulary is normal. Grammar is correct. But speech production slows. Words come out more slowly. Pauses increase. Speech may sound slurred or mumbled. Voice becomes softer or more monotone. This motor speech pattern, called hypokinetic dysarthria, reflects subcortical motor circuit damage. It is the same speech pattern seen in Parkinson's disease. This strongly points away from Alzheimer's and toward subcortical involvement. Sign number 1, difficulty with complex tasks while simple ones remain intact. This is the most defining pattern. Simple, routine tasks remain possible. Complex, multi-step tasks fail. The person can do basic math, but not complex calculations. Follow simple instructions, but not multi-step ones. Handle familiar routines, but struggle with anything new. This happens because subcortical structures don't perform thinking themselves. They coordinate communication between thinking regions. When those connections are damaged, integration fails, even if individual brain regions still work. This pattern is highly characteristic of subcortical vascular dementia. What you must do next. If multiple signs from this series are present, do not panic, but do not delay. This condition is largely preventable and controllable. The most important steps. Comprehensive cognitive testing. Brain MRI to identify white matter damage and small vessel disease. Aggressive control of vascular risk factors. High blood pressure is the leading cause. Diabetes, smoking, high cholesterol, and inactivity accelerate damage. There is no cure, but progression can often be slowed or stopped when risk factors are controlled. This is not Alzheimer's disease. This is vascular disease affecting the brain. And vascular disease can be treated. If this information helped you, share it. Someone may recognize these signs early because of you. Early recognition protects independence. Delay allows preventable damage. Knowledge only matters if you act on it.